Welcome to Top Best Health and Fitness Tips, your trusted source for science-backed health advice and practical wellness tips. Today we are revealing the 10 early signs of vitamin B12 deficiency you should never ignore 2026 complete guide. Vitamin B12 is one of the most important nutrients your body needs, yet millions of people around the world are deficient without realizing it. Unlike some vitamin deficiencies that produce obvious symptoms, vitamin B12 deficiency often develops slowly. The earliest warning signs are easy to mistake for stress, aging, lack of sleep, or a busy lifestyle. Vitamin B12 plays a critical role in producing healthy red blood cells, maintaining the protective covering around nerves, myelin, supporting brain function, DNA production, and energy metabolism. Without enough B12, nearly every system in the body can be affected. New research published in 2025 and 2026 continues to show that neurological symptoms may begin long before severe anemia develops. Scientists are also investigating whether current laboratory normal ranges may miss people with early functional B12 deficiency, especially older adults. Let's explore the 10 early warning signs of vitamin B12 deficiency that should never be ignored. Number 1. Constant fatigue that doesn't improve with rest. One of the earliest symptoms is persistent tiredness. You may sleep 8 or 9 hours but still wake up feeling exhausted. Many people assume they are simply overworked, but low vitamin B12 may prevent the body from producing enough healthy red blood cells to carry oxygen efficiently. When oxygen delivery decreases, you feel tired all day. Climbing stairs becomes difficult. Exercise feels much harder. You lose physical stamina. If you're finding these health tips helpful, don't forget to hit the like button. Unlike ordinary tiredness, B12 related fatigue often persists for weeks or months. Recent research suggests fatigue can appear during early functional deficiency even before obvious anemia develops. 2. Brain fog and difficulty concentrating. Do you frequently forget where you placed your keys? Do simple tasks suddenly feel mentally exhausting? Brain fog is becoming recognized as one of the earliest neurological symptoms of vitamin B12 deficiency. People often experience poor concentration, slow thinking, difficulty making decisions, forgetfulness, reduced productivity. Vitamin B12 supports healthy nerve communication and brain cell function. New studies published in 2025 and 2026 found that lower active B12 levels, even in some people whose total blood B12 appeared normal, were associated with slower cognitive processing and subtle cognitive decline, particularly in older adults. 3. Tingling or numbness in hands and feet. One symptom doctors never ignore is unexplained tingling. Many people describe it as pins and needles and burning feet, numb fingertips, electric shock sensations, crawling feelings under the skin. Vitamin B12 protects nerves by maintaining the myelin sheath. When deficiency develops, nerves become damaged. Without treatment, temporary tingling may eventually become permanent nerve damage. The sooner treatment begins, the greater the chance that nerve function can recover. 4. Poor balance or frequent falls. Vitamin B12 doesn't only affect feeling, it also affects movement. People may notice walking feels awkward. They trip more often. Standing on one foot becomes difficult. Stairs feel less stable. This occurs because damaged nerves interfere with communication between the brain and muscles. Older adults often assume balance problems are simply part of aging. However, subscribe now for trusted health, nutrition, and wellness videos every week. Vitamin B12 deficiency is a reversible cause of gait instability when detected early. Recent clinical guidance continues to emphasize subtle neurological symptoms as important early clues. 5. Mood changes, anxiety, or depression. Your brain requires vitamin B12 to produce important neurotransmitters involved in mood regulation. Low vitamin B12 has been associated with depression, anxiety, irritability, low motivation, emotional instability. Some individuals develop symptoms months before blood abnormalities become obvious. Researchers believe disrupted 1-carbon metabolism and changes in nerve function contribute to these psychiatric symptoms. 6. Shortness of breath and fast heartbeat. Many people blame poor fitness, but vitamin B12 deficiency may reduce oxygen delivery because of impaired red blood cell production. Common symptoms include breathlessness while walking, racing heartbeat curve, heart pounding, Lightheadedness, reduced exercise tolerance. Your heart works harder trying to deliver oxygen throughout the body. These symptoms deserve medical evaluation because they may also indicate heart or lung disease. Vitamin B12 deficiency is one possible cause among many. 7. Pale or slightly yellow skin. Healthy red blood cells give skin a healthy color. When vitamin B12 deficiency affects red blood cell production, skin may appear pale, lips lose their pink color, the face looks tired. Some people develop a slight yellow tint. This yellow appearance results from increased breakdown of. Turn on the notification bell so you never miss life-changing health advice. Abnormal red blood cells. Friends or family often notice this change before the affected person does. 8. A smooth, red or painful tongue. The mouth frequently shows early nutritional deficiencies. Vitamin B12 deficiency may cause bright red tongue, swollen tongue, burning sensation, mouth ulcers, difficulty eating spicy foods. Doctors call this condition glossitis. Some people also notice altered taste or decreased appetite. Although these symptoms may seem minor, they can provide an important clue to an underlying nutritional deficiency. 9. Blurred vision or vision changes. Although less common, vitamin B12 deficiency can affect the optic nerve. Possible symptoms include blurred vision, reduced sharpness, difficulty focusing, double vision in severe cases. Damage to the optic nerve may become permanent if treatment is delayed. Fortunately, early recognition often allows improvement after B12 replacement. Never ignore sudden vision changes. Many serious eye and neurological conditions can also cause these symptoms and require urgent medical evaluation. 10. Memory problems and confusion. Many people fear Alzheimer's disease when memory problems begin. However, vitamin B12 deficiency is one of the treatable causes of cognitive impairment. Symptoms may include forgetting conversations, losing track of appointments, difficulty finding words, confusion, reduced mental sharpness. Growing evidence suggests that even people with lower normal active B12 levels may show slower cognition.
Have you ever experienced any of these symptoms? Tell us in the comments below.
Cognitive processing, leading researchers to study whether earlier detection could improve brain health. Who is most at risk? Certain groups are much more likely to develop vitamin B12 deficiency. High-risk individuals include adults over age 60, vegans, strict vegetarians, people with pernicious anemia, individuals with Crohn's disease or celiac disease, people who have had stomach or intestinal surgery, long-term metformin users, long-term proton pump inhibitor acid reflux medicine users, heavy alcohol users. If you belong to one of these groups, discuss screening with your healthcare provider even if symptoms are mild. What does 2026 research tell us? Recent studies are changing how doctors think about vitamin B12 deficiency. Key findings include neurological symptoms may appear before severe anemia. Functional deficiency can exist despite blood B12 values that appear normal. Active B12, methylmalonic acid (MMA), and homocysteine may provide additional information when deficiency is suspected. Early diagnosis greatly improves the chances of reversing nerve-related symptoms before permanent damage occurs. Researchers are also exploring improved biomarkers and imaging techniques to identify brain and nerve effects earlier in at-risk individuals. How is vitamin B12 deficiency diagnosed? A healthcare professional may recommend complete blood count (CBC), serum vitamin B12 level (BAL), methylmalonic acid (MMA), homocysteine, holotranscobalamin, active B12 in selected cases. Additional testing if pernicious anemia or malabsorption is suspected. Diagnosis should be based on symptoms, medical history, and appropriate laboratory testing rather than a single number alone. Best food sources of vitamin B12. Vitamin B12 is naturally found mainly in animal-derived foods including beef force, liver ender, fish, salmon positive, tuna lays, sardines, eggs, milk, cheese tej, yogurt. For vegetarians and vegans, fortified cereals, fortified plant-based milks, nutritional yeast with added B12, Or supplements may be necessary because plant foods do not naturally provide reliable amounts of vitamin B12. Treatment. Treatment depends on the cause and severity of the deficiency. Options may include oral vitamin B12 supplements, high dose tablets, sublingual preparations, vitamin B12 injections.
Your like, comment, and subscription help us bring you more science backed health content.
For people with severe deficiency or poor absorption, treating underlying digestive or autoimmune conditions is most people improve significantly when deficiency is identified early and treated appropriately, although recovery of nerve symptoms may take months and may be incomplete if diagnosis is delayed. Final thoughts. Vitamin B12 deficiency is often called a silent condition because its symptoms develop gradually and can mimic stress, aging, or other illnesses. Persistent fatigue, brain fog, tingling in the hands or feet, balance problems, mood changes, memory difficulties, and a sore red tongue are among the early warning signs that deserve attention. Emerging research from 2025 and 2026 suggests that subtle neurological changes may appear earlier than previously recognized, and that relying solely on standard serum B12 levels may miss some cases of functional deficiency. If you have ongoing symptoms, especially if you are in a high-risk group, consult a healthcare professional for evaluation rather than self-diagnosing or starting supplements on your own. Early detection and appropriate treatment can help prevent irreversible nerve damage and support long-term brain, nerve, and blood health. Thanks for watching top-based health and fitness tips. We hope today's information helps you live a healthier and happier life. Stay healthy, stay informed, and we'll see you in our next health and fitness video. Take care.